Our Great War is a spiritual war. Our Great Depression is our lives.
Anxiety and depression, two prevalent mental health disorders with significant implications for individuals and society. Today, we will explore their definitions, problem statements, data and statistics, relevant theories, and proposed prevention and intervention strategies. Anxiety is characterized by excessive worry and fear, while depression involves persistent feelings of sadness and loss of interest. A lack of awareness and stigma often prevent individuals from seeking help. The global prevalence of anxiety and depression is alarming, affecting millions of people. Theoretical frameworks such as cognitive behavioral theory and the biochemical imbalance theory offers insights into the cause and treatment approaches for these conditions. Prevention and intervention strategies are vital in addressing anxiety and depression. By understanding the complexities of these disorders and implementing comprehensive strategies, we can improve mental health outcomes and enhance the well-being of individuals and communities.
My name is Rashalanya. Today I will be talking about the definition of anxiety and depression. What is anxiety? Anxiety is more normal stress or worry. It is a reaction to pressure, but for some it occurs without an apparent reason and becomes hard to control. It can significantly impact daily life, and there are various types of anxiety. Seeking help earlier can help regain control. What is depression? Depression goes beyond feeling and temporarily. It can persist for long periods, affecting both physical and mental health. It leads to loss of interest, energy, and difficulty of sleeping. The good news is that depression is treatable and effective treatment are available.
Hello, my name is Silen and today we're going to look at problem statements of anxiety and depression. First of all, we're going to look at anxiety and depression on individual level. Anxiety and depression impact well-being, relationship, education, and works. Barrier to seeking help leads to insufficient treatment. Next up, we're going to look at anxiety and depression at family and community level. Anxiety and depression strain family and communities, causing social isolation and reduced cohesion. Next up, we're going to look at anxiety and depression at healthcare system level. Anxiety and depression burden healthcare system, leading to a long waiting times and limited access to care, causing economic cost. Finally, we're going to look at complex nature of anxiety and depression. Anxiety and depression are complex conditions influenced by various factors requiring tailored treatment for comorbidity.
Anxiety and depression are common mental health conditions that can be caused by biological, environmental, and psychological factors. They can have a negative impacts on physical health, quality of life, and also social relationships. Biological factors include genetics, brain chemistry, and hormones. If you have a family history of anxiety or depression, you are more likely to develop these conditions yourself. The next one, environmental factors, includes trauma, abuse, and daily pressures. Constant stress can take a toll on your mental health. And lastly, psychological factors includes negative thinking patterns and past experiences. These can make you more vulnerable to anxiety and depression. So anxiety and depression can lead to negative impacts in our lives, which is it will lead to fatigue, appetite changes, and also weaken the immunity. They can also make it difficult to enjoy activities and feel connected to others.
Next up, we will be looking at data and statistics. Global prevalence. Anxiety disorders are estimated to affect around 284 million people, whereas depressive disorders are approximated to affect around 322 million people globally. Furthermore, gender difference. Global 12-month prevalence of major depressive disorders was 5.8% in females and 3.5% in males. Next will be comorbidity. Depression and anxiety frequently co-occur, especially in primary care settings. Between 10 to 20% of adults in any given 12-month period will visit their primary care physician during an anxiety or depressive disorder episode. Besides that, impact on global health. Anxiety and depression are among the leading causes and estimated that 5% of adults suffer from the disorder. Impact: complex interactions between social, psychological, and biological factors. Next up will be impact on social media. Teenage and young adult users who spend the most time on Instagram, Facebook, and other platforms, 13 to 66% have a higher rate reported of depression.
My name is Nur Alia binti Muzamil and I'll be presenting about the prevention and also the intervention strategies. First of all, in terms of prevention, there are 3 things that can be done, which are exercise, having a balanced diet, and also getting enough sleep. By doing exercise, it can release feel-good endorphins, which can take your mind off worries and negative thoughts. Other than that, a balanced diet, staying hydrated, and avoiding alcohol and caffeine also contribute to relieving stress. Getting enough sleep is crucial too. Research has shown that a sleepless night can increase anxiety by up to 30%, and deep sleep acts as a natural anxiety reliever, which restores brain function and regulate emotions. Now let's move on to the intervention strategies. Intervention strategies are essential, especially for those who are already with anxiety and depression. The first intervention strategies is counseling. It can help individuals with anxiety and depression explore and resolve their challenges. Other than that, cognitive behavioral therapy or CBT, which teaches new ways of thinking and responding, also help in reducing anxiety. Lastly, self-help and support groups, which provide a platform for people to share experiences and coping strategies, also help those with this condition. However, it's important to be cautious and not replace professional advice completely. To conclude, prevention and intervention strategies go hand in hand in managing anxiety and depression. So by combining healthy lifestyle choices, therapy, and support networks, we can make a significant impact on mental well-being.